sniffling through the next few months, the cold season. And if you get sinus infections as well, you're looking at a season of true misery. But now, as Channel 2's Dr. Max Gomez tells us, there is hope of getting through the winter with your sinuses and your sanity intact.
It's that time of year, all right. Lots of colds flying around, sneezing, sniffles and all. But does every cold you get turn into a major event? You know, decongestants, antihistamines, nasal sprays, big-time headaches, and even antibiotics? Maybe what you have isn't a cold at all. It might have started out that way, but now it's a sinus infection.
Sinus disease affects about 31 million people, and across the United States, that is, which is about probably 10% of the population.
A lot of low-grade fevers and a lot of headaches and pressure makes you tired and irritable. You know, it's hard to even get up and go to work, and by the end of the workday, that's all the energy you have left.
Yeah, very narrow passageways, and that's what's giving you headaches.
Brian Hartman has tried everything. Weeks and weeks of medications would help for a while, but then the infections would come right back with the next cold. So today, he's opting for what used to be the absolute last resort, sinus surgery.
This might be drastic to some people. To me, this is what I need to continue life on a normal basis.
The modern-day version of sinus surgery is a marvel compared to the old days. First of all, it's local anesthesia. I could actually talk with Brian while he was being operated on.
It's a little bit of pain, someone to poke through your nose, but it's not that big of a deal.
But what's really revolutionized this type of surgery are devices called endoscopes that allow Dr. Josephson to see right into the sinuses and use special instruments to probe, cut, and remove bits of misplaced bone and diseased tissue.
What we're doing here is actually returning the nose to its normal function by providing the patient with more room in their sinuses for their sinus to drain properly, and also to filter the air that we breathe.
Sinuses are actually cavities within the bones of the face and skull, which means they're just millimeters from the brain and eyes. They're lined with membranes that produce about a quart of mucus a day that should drain out to the nose through tiny openings. If those openings are blocked, the mucus backs up, which is a great place for bacteria to grow, not to mention building up the pressure that causes those excruciating sinus headaches.
It's going to make a big difference in his life. He'll be able to breathe better. He won't have the pressure sensation or the headaches.
Surgery made a big difference in the lives of Mona Murphy and Marcel Grant. Both had suffered with chronic sinus problems.
In the years before I had surgery, I used to think I was this chronically sick person. I would get colds all the time, and they would last for a long time. My energy level soared. I mean, I felt like a completely different person. I got off antibiotics for a change, cut out a lot of the decongestant medications and all the things that I had been on for years and years.
Now, obviously, surgery is not for everyone with a runny nose and a headache, but if your colds last for more than a week or always become sinus infections, and the makers of Contact and Sudafed sent you Christmas cards, you might want to consider it. By the way, I had the surgery done myself about 6 years ago, and it's amazing how much healthier I feel. The key is to find a surgeon who is really experienced in doing this kind of endoscopic surgery.
And you were awake through this like those people?
No, actually, about 6 years ago, they were still doing it under general anesthesia, so I was asleep. I didn't hear all the sucking and...
We got a little squealy in here seeing that,
progress isn't always good.
yeah.
Yeah, that's right. Depends on how you look at it.